25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida. Hello, South Florida and beyond, and welcome to the You and Your Doctor Living a Longer and Healthier Life show. We're going to be talking about the ears, nose, and throat this evening with Dr. Hina Gupta. She is with ENT Medical Specialist, an otolaryngologist in Coconut Creek. That one always gets me, but welcome to the program, Dr. Gupta. How are you doing?
Thank you. Thank you for having me.
And thank you for joining us. I always say on this adventure of health, we can see you and hear you loud and clear. So let's get right into it. So an otolaryngologist, and I'm probably saying it wrong. You'll probably say it right.
Otolaryngologist.
There it is. Every time. This is the third. Perfect. This is the third time I've had you on the program, so I should know by now. But tell us a little bit about the medical specialty, because it's a very unique specialty because of the different parts of the body that it covers.
Right. So oto means ear. Laryngology is actually the vocal cord, so in the throat. So otolaryngology is ear, nose, and throat. It's actually called, before it was called otorhinolaryngology. And that's how ENT came about. And so otolaryngology basically covers the medical and surgical treatments of anything that happens above the clavicles, excluding the brain. So when you have ear issues, nasal issues, throat issues, you would see an otolaryngologist.
Great description. And let's start with the ears. So what are some of the most common ailments that you see in the office, for ear conditions or ear ailments?
The most common ear ailments would be ear pain and hearing loss. And so, of course, we know that ear infection can cause ear pain, but more and more, especially during high stressful times, especially with COVID, I've been seeing a lot more of ear pain that's not because of an infection. And so oftentimes you can get ear pain, and it can be from other reasons like temporomandibular joint syndrome or inflammation of the jaw joint. And that happens when you clench or grind your teeth at night. And so that's why when you have this muscle tension and high stress, you often think that it's your ear. So ear pain is something classically that it presents with.
So that's interesting. So the stress, not actually, we can go into COVID, but actually the stress from everything that's going on can cause ear issues, because we're all, obviously we've all been in this together, but we're all a little worried in different ways, right? So that can actually cause an ear condition?
Well, it can cause ear pain. So it's referred pain into the ear because the jaw joint is right adjacent to the ear. And so if we have tension in our muscles, particularly the muscle that open and close our mouth, these muscles right here, it can cause this ear pain. And a lot of times I have patients who come in who've been on different antibiotics, and they're like, Doc, I've been on my third antibiotic and I keep getting these infections. And so the first thing that we do is a simple ear exam to see, because if we have something like an infection, then we should see some footprints like swelling, drainage, other things that you would see because of an infection.
And that's when you look into the ear with the device and you're able to see in there and actually into the ear canal and what's going on?
Right. So the device, the otoscope, would be the first thing that you would do, right? So the first kind of tenet of medicine is do a physical exam and make sure that it jives with the history that you're getting. And so it's not, I've seen it more because muscle tension, like tension headaches, can present as different things. And so that's why during this high stress time, a lot of people are very stressed. I see different complaints, especially in the head and neck, because of that. So the first thing that we would do is an exam, but then after that, the other things that we would do to help diagnose ear issues is an audiogram. And so we have an audio booth in our office so we can do a diagnostic hearing test. Basically, it's one of the most important things we do to evaluate the ear.
And that's available right in your office. Right
yeah.
On the.
So yeah, we have an audiology booth and an audiologist who comes once a week to administer those tests because hearing loss creeps up on us, especially as we age. So we kind of forget. We don't really know. It's like 70% of people over 70 years of age have some degree of hearing loss, and so one of the things that we have to do when we're evaluating the ear is obtain an audiogram. And evaluate that.
Now, do you also offer treatments for ear ailments? Obviously, you're able to diagnose it and test diagnostically. Do you also offer some treatments?
Absolutely. So it depends on what the ear symptom is and what the diagnosis is. So if we're looking at ear infections, obviously we do those. We have antibiotics. We also administer topical antibiotics under the microscope. Other things, if it's just a hearing loss issue, there's different types of hearing loss. There's a conductive type of hearing loss or a sensory neural type of hearing loss. So the conductive type is when you have little kids who have fluid in their ear because they have recurrent ear infections. That's a different type of hearing loss than when you're elderly and you have a hearing loss because of a nerve pattern hearing loss. So just depends on what kind of diagnosis that you fit into. I always tell patients, because there's so much hesitancy on getting hearing aids, especially as you age, there's just a social connotation that goes with it. And I describe it similar to glasses. When we can't see, everybody gets glasses very quickly. But when you can't hear, people don't want to get hearing aids. And part of that is just a social aura along with it. But people don't know that it can be very socially isolating and can even contribute to depression as you get elderly when you can't hear different conversations, especially in party environments or in family environments. So the bottom line for hearing loss is hearing aids.
That's a great anecdote because I'm one of those people. I didn't get glasses until I was over 40, and yeah, I couldn't see long distances, and it's been life-changing. And if I was had a hearing issue, knowing what I know now with glasses, that's a great point. I would definitely try out hearing aids. So thanks for mentioning that as well. We're here with Dr. Hina Gupta, MD. She's an otolaryngologist in Coconut Creek. Website is easy, sfenta.org. That stands for South Florida, enta.org. 954-943-1418. And located right in Coconut Creek, 4515 Wiles Road, suite number 201. We're starting out with the ear, and the first time I had you in the program in the radio studio about a year and a half ago, we talked a little bit about earwax. Can you tell us a little bit about earwax? And I always like to ask you this question. Should we be using a Q-tip every day, or should we let the earwax kind of do its natural thing?
So I tell people that you shouldn't put anything bigger or anything smaller than your elbow in your ear. And so basically Q-tips are not recommended because they push the wax in. And so It just, every time you shower, you turn your head towards the shower and let the water go in and let the water come out. And the majority of patients get perfectly healthy, clean ears from that.
That's interesting. Yeah. Because you're just with the Q-tips, just pushing it back in. Very interesting. We got about a minute till the commercial break, so let's talk a little bit about what are the most common nose ailments you see in your office.
So especially in South Florida, allergy is a big contributor. And so patients come in with doc, I got the sinus. But what they're referring to is nasal obstruction, like they can't breathe or they have nasal drainage. So their nose is constantly running. So the two most common complaints are, I can't breathe, I have nasal obstruction, and I have a runny nose. And so there's a lot of things we offer, and especially now, there's a lot of cutting edge things that we can offer to help relieve those symptoms. So when we start with that patient, a good physical exam is the beginning. And so with the good physical examination is a speculum exam, but when you come to see an ENT or an otolaryngologist, it's very common practice to look deeper in the nose with what's called a nasal endoscopy. It's a little tiny camera that we use to look deeper where the sinuses actually drain to see if there's pus or if there's polyps or if there's actually a mass that would be deeper in the nose.
Very interesting. And let's take a quick commercial break. We'll be right back with Dr. Hina Gupta. We're going to talk more about the nose and throat on the You and Your Doctor show. Stay tuned. We'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor show. We're here with Dr. Hina Gupta, otolaryngologist in Coconut Creek, ear, nose, and throat. The website is sfenta.org. Number is 954-943-1418. We talked a little bit about the ears. You're an ear specialist, but you're also a nose specialist. What are some of the you talked a little bit about the diagnostic services, the way that you look into the nose. What are some of the treatments available that you can offer the South Florida community for nose ailments?
So we evaluate and treat the total nose. So the treatments include both medical and surgical therapy. And so oftentimes when we have nasal complaints, we can do allergy testing, like allergy skin testing, to see what particular allergens the patient is affected by. And then alongside with that, there's medicines that we treat, nasal sprays and things like that that we classically know of. But then with that, there's a lot of new procedures that are out there to help you breathe better. One of them is if you have significant sinus problems, if you're on antibiotics a lot, or if you have chronic sinusitis, we can offer balloon sinuplasty where you can open up the sinuses with a little balloon. We can reduce some of the tissue in the nose so that you can breathe better with different techniques that are minimally invasive. There's so many new things out for the nose. It's just really exciting. Even 5 years ago, there weren't some of the different things that we're doing now. And one of those things is called Clarifix, where we can freeze the nerve that causes the nose to run so much. And so there's a lot of patients who just, my nose runs when I eat, when I'm outside, when I'm in the air condition. And so there's a lot of new things that we can do so that we can improve the quality of life for our patients.
Like the ear, can the nose over time, tend to have more ailments, develop more ailments is what I'm saying as you age? Is that something that you generally see, or is it kind of just random?
So it's not as clear cut as like hearing loss associated with aging, but we do see more and more allergies for just across the board. And that's not just in elderly patients, we see it in children. Like there's way more patients affected by allergies now than were 20, 50 years ago.
Yeah, that's interesting as well. The third part, the main three areas you cover, but you were telling us you cover everything, the ear, nose, and throat above the clavicle, is the throat or larynx. What are some of the most common throat or larynx ailments that you see regularly in your office?
So the most common thing I probably see is a sore throat. And still, the culprit is it can be usually tonsil issues, especially in young children or young adults. So that's still among one of the treatments that we do is take out tonsils. But more so, we're seeing a lot of, doc, I feel something stuck in my throat, or I'm clearing my throat a lot. So it's not just overt throat pain, but it's throat discomfort that's low lying. And that's a very common thing I see in clinic all the time. And one of the reasons that could be is from laryngopharyngeal reflux. So now you're going to ask me what laryngopharyngeal.
Yeah, because I never heard of that. So I'm thinking like acid reflux, but throat. Am I on the same page?
That's exactly right. So you don't classically have this burning that you feel like from what people consider reflux, but it presents with extra esophageal symptoms. So the symptoms that people come in with are hoarseness, a cough that doesn't go away. So those are the two most common reasons, or like this low-lying, like I feel like something's in my throat. And so the first thing that we do is obviously a physical examination. And part of that is taking that little camera that I was discussing and putting it down to see the larynx and the throat and to see what we see on exam. And there are classic exam findings that we see when there's not a mass or there's not an infection, but there's inflammation secondary to reflux.
That's great. That's amazing. That's why we do this program. And where else are you going to get this kind of information on a weekly basis? I'm not just saying that because this is, a show I do, but that is amazing. We're here with Dr. Hina Gupta, MD, otolaryngologist in Coconut Creek, ears, nose, and throat. The website is sfenta.org, numbers 954-943-1418. Located in Coconut Creek, 4515 Wiles Road, suite number 201. Never been there, but I've been on your websites, and I've seen beautiful pictures of the office. Very modern, brand new, sleek, beautiful building. So definitely check out Dr. Gupta if you have any ears, nose, or throat issues. Now, I also want to talk about, you mentioned you treat the younger population, so you treat all age range of patients pretty much, right? From the youth all the way up into the elderly.
Absolutely. But David, can I tell you that our new website is browardspecialtygroup.com, and you really have to come because I'm one part of a multi-specialty kind of center that we have in Coconut Creek. And we have ENT, urology, pain management, GI, interventional radiology, and orthopedics all in our center. And so there's a lot of really good medical care that goes on in our building. And it's a new facility. So I want you to go to browardspecialtygroup.com to look at all the services that we offer.
Thank you for correcting me. Yeah, BrowardSpecialtyGroup.com. I appreciate that. Yeah, amazing. Medical specialties that your group covers. That is a lot of different specialties. So that's great. So do patients need a referral to see an ENT like yourself, or can they just book online or give you a call in the office?
So all of the above, it really depends on what kind of insurance that the patient has. Now, more with an HMO or Humana, they need insurance referrals from their primary care doctor. So you can always call and make an online appointment, or you can just call our phone number at 954-943-148. And when you do that, they'll tell you when they discuss your insurance if you need a referral or not.
That's great as well. Yeah, great office there. So how has your ENT practice changed during the pandemic? Do you have obviously everything's kind of changed. What are some of the open and safe protocols you have in place at your office?
So during the lockdown, we were only seeing semi-urgent and urgent patients, but since then, we are doing a screening protocol and temperature check, very similar to the hospitals across the nation. We have the option of waiting in the car and being taken straight to your exam room. All of our staff, including the front desk, the nurses, the MAs, the physicians, all wear the PPE, the personal protective equipment. And we have the option of seeing patients via telehealth. And we've been in this pandemic long enough that I've been seeing patients on telehealth, and then we've had few patients come in for their follow-up appointments. And so certain things like taking out your wax, I really can't do over the phone, but we've had a number of patients who have seen via the telehealth who have improved if they've had other conditions that can be treated as such.
Yeah, it's another great option. I think doctors have been able to really change with the course of time here, because like I said a few shows ago, doctors were already wearing gloves and masks especially during their residency training and whatnot, but they've already done this before. Speaking of education and training, we have a couple more minutes. Tell us where you did your medical school and residency.
So I did my medical school at University of Missouri in Kansas City. And after medical school, every physician goes through a residency. And for surgery, it's a minimum of 5 years. And so for me, I did a 7-year residency. I did 5 years of surgery and then 2 years of master's in public health. And that was at the University of Iowa in Iowa City, right in the middle of the country.
Yeah, that's great. Wow, 7 years. That's an amazing amount of education and training. I've heard this before. They call the University of Iowa the program. It's renowned in the field. Why is that so? I kind of looked into it, but it's world renowned for what they do, right?
Yes, and it has been for a lot of the surgical subspecialties, especially otolaryngology, and it's just been cutting. So the U.S. World and News sends out a report based on the amount of the level of training, the different parts of the training, the research that the facility has. And University of Iowa was known for some of the first cochlear implants, the first genetic testing for hearing loss, some of the leading research on human papillomavirus and head and neck cancer. So there's a lot of research that has gone on there. I mean, it's such a great facility that last year my 5-year-old nephew, had hearing loss, complete dead ear in one side. And I actually took him back to University of Iowa to get his cochlear implant surgery.
That's amazing. Well, we ran out of time, but so much great information. We'll have to have you back on, Dr. Hina Gupta, BrowardSpecialtyGroup.com. There, I got it right that time, 954-943-1418. Thank you, Dr. Gupta. We'll talk to you soon.
Thank you. Appreciate it.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.